The opinions expressed in the Brothers-in-Law show are for informational purposes only and are not a substitute for personal professional legal advice.
Thanks for tuning in to Brothers-in-Law on Go Country 105. I'm Larry Mandel.
And I'm Rob Mandel.
And we've been trial attorneys here in Los Angeles for over 40 years.
On our show, we will discuss current events, talk about legal issues, and have some very entertaining guests stop by. So stay tuned every week for Brothers-in-Law right here on Go Country 105.
Welcome back to another episode of Brothers-in-Law Zoom edition. I'm Larry Mandel.
And I'm Rob Mandel.
Hey, Rob, how are you holding up under the COVID virus dilemma?
You know, pretty good. Everyone I know is safe and sound, but we've been hunkering down. You know, we've been, locked down and just staying at home pretty much. And as you know, we're operating our law practice remotely.
Yeah, it's been tough times, but hopefully people are staying safe and healthy.
And how are you doing, Brother Larry?
Brother Larry's doing very well. Yeah, I'm staying healthy.
I don't think I've seen you. I don't think I've seen you this whole time, which is weird because normally I see you every day.
Yeah, it's been 2 months.
Yeah.
March 13th.
Right. Well, it's more than 2 months.
Yeah.
So, Larry, before we welcome our wonderful guest today, you know, we've been asking our listeners to call in and nominate a local person or group who's going above and beyond during this pandemic for their community. And we've just gotten a tremendous response, haven't we?
Oh, that's right. It's great that people are really, participating.
Right. So I guess producer Cam has someone on the line that, someone called in and wanted us to hear about someone that they nominated. So let's take a listen.
Hello, happy day. This is Carmela Lucatero. I would love to nominate Dr. April Lopez out of Orange, California. She is a chiropractor / doctor for her own chiropractic. Sorry, I'm a little bit nervous, but she pretty much does Baker to Vegas. She helps all the officers get ready for the races in Vegas. She helps a lot of law enforcement get better, pop back to business. She does this out of her own time. Come Baker to Vegas running season, we compete against other law enforcement. My name is Carmela Lucatero. I'm a retired correctional officer. I was medically retired because of a lot of my medical issues.
Okay, so, Carmela has nominated a chiropractor out there in Orange, April Lopez, who is helping our first responders during the pandemic. And do we have Dr. Lopez on the phone?
Yep, I have Dr. April Lopez of Stadium Chiropractic in Orange, California on the line.
Hello, Dr. April Lopez.
Hello, how are you today?
We're doing well, thank you. And yourself?
I'm doing well as I can be right now with everything going on. Thank you for asking.
So Dr. Lopez, tell us what's going on exactly, because you've been nominated as basically a hero in the community by your patient Carmela. So what's going on?
Well, I'm humbled by that. I guess a little embarrassed because I don't know really what that means. In being nominated for being a hero, because obviously there's a lot of heroes out there and a lot of people working in the community to help others, and we don't hear enough about that. But in terms of what we're doing here, I've been practicing 24 years, and I see lots of patients, and I do see a lot of law enforcement. And so for us, we're taking care of those people out there that are working from home, but a lot of people that are on the front lines, and we're just trying to do our best, do our part to take care of our community.
That's wonderful.
Yeah, that's great.
And do you have to take, obviously you have to take some special precautions. And so are you, in order to treat these folks and get them out of pain, are you basically exposing yourself to some extent?
Well, I mean, I do believe anybody that's working the front lines and working out there, and there are, like I said, there are a lot of people in the community doing that, and me and my staff as well. I at the end of the day, I feel more tired than I do on a typical day prior to COVID because we've taken all the precautions. I don't let anybody in the same room, even during check-in. Everybody's in a separate room. I do wear gloves. I do wear a mask. I happen to have a special needs daughter at home who's 17 now, who has Down syndrome, who's autistic, and will need another surgery. Did have a heart surgery once before. I also take care of my dad, who's 82. So I think initially we took a week off when everything was going on, but because we're essential workers, I felt really guilty being home because I felt like I needed to do my part, and people were waiting for me. And so that 1 week taken off, I said I had to be here to take care of those that need to keep going back to work, that are hurting. And there's a lot of there's an emotional component to that too, and the stress out there that people are feeling, not just from an injury, but the stress of putting themselves in the front lines, helping others. So it's a whole combination. There's some patients that are staying home that don't talk or see anyone, or don't have anyone even touch them, that are isolated. So I think that what we're doing here is very it's rewarding to help those and to make a difference.
Well, that's a great story, Doc, and Carmela was right on nominating you. Thank you very much.
So Dr. Lopez, we're going to send you some gift cards to Whole Foods. You got a Whole Foods nearby you?
Oh, absolutely, and thank you for that. I did. Yeah, but thank you so much.
Just as a little thank you, just a token of our appreciation for what you're doing out there.
Well, thank you, and thank you for. I think a lot of people are listening to you all and putting positive energy out there. I think we hear enough of the negative stuff, so it's nice to hear some of the positive, half glass, half full versus the half empty. Because I think
definitely
there's positive things out there happening.
Right. Positive healing.
Bye, Doctor.
All right. Thank you so much, Dr. Lopez.
Thank you so much.
Have a great day.
Take care.
We're Larry and Rob Mandel, the brothers-in-law, here on Go Country 105. Do you have a legal issue you need help with? We want to hear from you.
Find us on Instagram and send us a message. Then tune in on Saturdays at 8 a.m. right here on Go Country 105.
Do you need help feeding your family right now? We all know that schools are closed, and some kids rely on free or reduced price meals at school. Visit fns.usda.gov/meals4kids to find a grab-and-go meal center near you. They are offering 2 grab-and-go meals for kids. Again, please visit www.fns.usda.gov/meals4kids. 4 is the number 4. And let's make sure all the kids are fed.
Larry, a lot of people have these concerns that they want to stay at home, but they may need medical care. They need to go to the ER for other reasons and be afraid to do this and may not even go out of fear.
Yeah. In fact, a survey of 9 major hospitals earlier this month showed that the number of severe heart attacks being treated in U.S. hospitals had dropped by nearly 40% since the virus took hold in March. Yeah. Leaving doctors, they're concerned about that. And here to break it down for us is trauma surgeon and vice chief of staff at St. Mary's Medical Center, Dr. Mauricio Heilbron, a.k.a. Dr. Mo.
Welcome, Dr. Mo.
Welcome.
How's it going? Yeah, my first name is Mauricio, which is kind of complicated, so that's why they shrink it to Mo.
I see. Mauricio. Thank you, Dr. Mo.
Mauricio. Welcome to our show.
Yeah.
Dr. Mo.
Dr. Mo. So some of the things that we just addressed, have you seen a decline in patients coming in to treat for medical emergencies?
Yeah, overall, the number of patients coming in for emergencies that are unrelated to COVID and that are more medical. Now, I do a lot of trauma, so people are still getting in car accidents, people are still getting shot, that's still happening. But you're absolutely right in terms of the heart attacks, the medical emergencies. We're seeing a trend down And that's going to be one of the more interesting things that comes out of the research a couple of years from now when we kind of look back at all this stuff.
So there are certain risks involved by these people avoiding the ER, correct?
Oh, absolutely. There is that fear of, I'm going to go to the hospital and that's like where COVID is and I don't want to go there. When the reality is, if you need to go, you go. If you would have had to go before, you should go now. There's a little bit of common sense that we need to use here, and we know that's pretty rare nowadays. But there are studies now in New York showing that some of the first responders, the people in the hospital that are exposed, may have lower infection rates than we expected, which means the mask, the distancing, that sort of stuff works. It means we're taking the right precautions.
We're doing the right thing.
But positively, it means that it's safe to go to a hospital.
And in fact, don't these hospitals take pretty good precautions? They have areas set aside where people come in basically by themselves, things like that. Can you tell us a bit about that for your hospital?
Yeah, we got started pretty early, which was you treat everybody like they have COVID. I mean, this is scary stuff. And we were treating it seriously from the beginning. So yes, isolation, taking patients that may or may not have COVID and treating them as if they did separately, the testing, the keeping them away from other patients. Now, let's say somebody comes in a car accident. You don't separate them. You treat them as if they're a car accident patient with extra precautions. So that meant we would take higher precautions, gloves, masks, protections, that sort of stuff, doing the same for the patient, putting a mask on the patient, protecting them. So yeah, we've been making this up on the fly. And the fact that we're doing it is kind of cool.
Yeah.
Very cool.
Makes a lot of sense. And so what do people do? Let's say they are in a car accident. They're going to the ER or they feel chest pains, things like that. What do they do en route to the ER? Let's say they're driving in there. Do they wear masks? What kind of precautions do they take?
Well, and pretty much everybody nowadays has a mask or something. So that's independent. Wear a mask anyway. But if you're that sick, focus on yourself and go to the ER. In fact, call ahead if you want to. That's what I've been telling people to do is call your primary care doctor, call your insurance plan, call whoever you need to call initially and start the process going. If you're going to an ER, call the ER ahead of time. They're going to ask you once you get there, do you have any symptoms? Is there anything, because people forget, just because COVID is here doesn't mean nothing else is happening. People are still getting sick. People are still having appendicitis. What I'd like to tell people is go. Don't sit at home. If you need to go, go.
Yeah. And so what if someone has that reluctance to the point where they just don't go and they're suffering in some kind of unusual or immense pain, like an appendix attack? What risk are they taking by balking or not going?
Significant risk. In fact, there was an article a month ago that said there's a hospital in Seattle that had the same number of ruptured appendix patients as they did COVID because so many people were waiting.
Oh my.
Yeah. So the risks can be alarming and many of them can be mitigated by a simple phone call, by a simple discussion. In fact, our hospital has virtual consult where you can log on, talk to somebody online, go over the stuff, maybe even show them a wound or describe your symptoms, and at least get a second, like somebody else, a Jiminy Cricket on your shoulder.
Yeah, that's nice. And where is St. Mary's? Can you give us the lay of the land there?
Yeah, I'm in Southern California. So St. Mary's is Long Beach, sort of closer to the water, down by the end of the 710 freeway. It's one of the two main hospitals in Long Beach Memorial and St. Mary's.
So, Doc,
that's right.
Before we got on the air, you were indicating that you've been working nonstop every day. One day you took off, right?
Yeah, it was my birthday. My wife made me take that off. But yeah, basically, I remember I took the day off for the Oscars, which was February 9th. I wanted to sit at home and just watch the Oscars. And since then, because I'm a general surgeon, a trauma surgeon, a vascular surgeon, I'm involved at the medical staff level. It's all hands on deck. And I understand what your caller said about you feel kind of guilty staying home because this is kind of what we're supposed to do. This is what we're built for.
It's kind of all hands on deck kind of thing. Yeah. And we were talking about, and now if someone's not going to watch our YouTube of this, but the listeners should know that you're sitting there in scrubs right now. You're ready to go right now.
I'm ready to go. I was ready to go, but I had a surgery this morning, but now all elective surgeries as a precaution must be COVID tested.
That makes sense.
It does, but one of our problems is that inherent problem with testing. They're not reliable and they don't come back in a timely fashion. It's not a criticism. It's hard to understand for people that we didn't even know what this existed 6 months ago. We didn't even know this existed 6 months ago. It's a new thing. We had to create tests for it. So we're trying to be patient. It's understandable. The patients have been great. We'll get through this. It's going to happen. We'll get better at this.
We're Larry and Rob Mandel, the brothers-in-law, here on Go Country 105. Do you have a legal issue you need help with? We want to hear from you.
Find us on Instagram and send us a message. Then tune in on Saturdays at 8 a.m. right here on Go Country 105.
From all of us on the Brothers-in-Law Show, we want to give a big thank you to these sponsors who we've partnered with to help honor our local heroes and groups for going above and beyond for their community. We'd like to thank Ralph's, Whole Foods, Target, and Chipotle. Thank you for all you do in our community.
The tests have evolved. I've had it twice now, and the first time was with the nose, and the second time was with the mouth. What testing is now being done, and is it more reliable?
Oh, geez. The testing is they roto-root your nose, they swab the back of your mouth, they prick your finger, they take blood. In some of the sicker patients, they're actually, once you're on a ventilator, they'll go into your lungs and sort of wash out some of the deep stuff in your lung and suck that stuff out.
Wow.
The honest answer is we're trying to find it in as many places as we can to try to get some sort of sense of what's going on. Again, we're living in the middle of a research study. We're figuring stuff out every day. So the best advice I can give is if you think you need a test, get tested. If it's negative and you feel good, you're probably fine. If it's negative and you don't feel good, keep checking and talk with your doctor. And we'll do it anyway. Trust me, the doctors are starting to get sensitive enough that we're repeating tests. We're being vigilant. We're trying to get to the bottom of a lot of the stuff.
And why is it that the testing takes, a few days or whatnot? Is it that they have to grow the virus in like a petri dish or something like that?
No, it depends on there's so many different types of tests and there's only so many places that can do it. We're just so used to everything being easy.
Yeah.
A problem now, it's hard to describe that if you swab your nose, you treat that different than if you do a pinprick on your finger. And that gets treated different than a blood test where you put in a test tube. It all gets handled different. It all gets processed different. And it gives us different information. So putting that all together right now is really difficult because people need to know right now. So, but like I said, we're getting there. The more data we get, the better information we can give you guys.
And so, Doc, you're a trauma surgeon, and you'll be seeing patients like appendicitis and hernias.
It's sort of. I'm also a general surgeon, and the general surgeon is the one that does the appendicitis, the hernias, the gallbladders, that sort of stuff. But as a trauma surgeon, I see the car accidents, the gunshot wounds, the fall down, crack their skulls open, the fights, the assaults, the drunk people that fall off bar stools and break their whatever. I mean,
yeah, so many.
Trauma surgeons have to live inside the hospital. So 4 to 6 times a month, I go to the hospital 8 in the morning and I don't leave till 8 in the morning the next day. And there's a new one of us every day. And that's one of the functions of a trauma center. So that's the type of patient, when I'm wearing my trauma hat, that's the type of people I see.
And how long have you been doing that? Because, Larry and I, we've been dealing with trauma patients, so to speak, for 30 plus years each. And of course, we see these folks after they're pretty much out of the hospital and whatnot. But I can see how that would be quite a challenge to deal with one severely injured person after another. How do you do it?
I think it's genetic. I've done this. I've been a trauma surgeon since '98. But my dad was one of the original kind of guys doing it in Long Beach, and he was at the hospital for 50 years.
How about that?
So, and if I'm going to be kind of nerdy here, I grew up loving comic books. And if there's an element of me that has always wanted to be a superhero, I don't spin webs, I don't fly, but my little tiny superpower is I guess I can help the occasional person. So there is a bit of that to it. I do like that sort of immediacy. There's not a lot of BS if you think about it. You just help people. A lot of times I don't even know their name. You just help them. And that's really appealing to me.
Well,
yeah,
I'd like to nominate him as one of our heroes right now.
I second it.
Yeah.
No, actually, thank you. And that's really cool. But this is what I'm built for. I mean, I take a hero as like the postman who saved somebody's life, or the grocery store person thank you. I don't want to be a dickly, but honestly, this is cool. I get to be a doctor now. I like this. I mean,
that's a great attitude.
Yeah.
It's a fantastic attitude because, I know a lot of guys in the medical field who have done trauma as like a rotation, or they did it as part of their residency. And once they got their residency status, boy, that last thing they wanted to do was any more trauma at a hospital. It's just tremendous burnout.
It is hard, but the burnout for me isn't the trauma because I mix it with vascular surgery in general. I try to be, a little bit more diverse, and I think it makes me a better doctor. The burnout isn't coming from the work. There's joy in the work. The burnout is from your hospital administrators. Your burnout is from the rules and regulations that have nothing to do. Your burnout is from people that don't trust you nowadays because everybody's questioning doctors and care and science and medicine when honestly, we're just trying to do the right thing.
Absolutely.
Well stated.
Have you suffered or been injured by someone else's negligence? When you need a legal team that will stand up for what is right, won't give up the fight and obtain justice, call 818-886-6600. Mandel Trial Lawyers specializes in personal injury cases of all types. Whether it's a car accident, product or premises liability, dog bite, or a catastrophic injury, Mandel Trial Lawyers are there for you when the fight is worth it. Call now for your free consultation. 818-886-6600. Let the scales of justice tip in your favor.
And now you are vice chair, if I read that or if I heard that correctly, of the of staff. So, or vice chief of staff. Now that's an administrative role. What do you do as that? What does that entail?
So the chief of staff is the doctors in the hospital elect one doctor to sort of run doctory stuff. So it's not administration, like we're not worried about electrical plant stuff or insurance contracts or stuff. When you're in the medical staff, your charge is the care of the patient in the hospital and then the doctors themselves. So any decision-making that happens at a hospital has to go to the medical staff. And I got elected as the kind of head doctory guy.
You're kind of a watchdog to some extent, right?
Yeah, it's just, there's a lot of stuff that needs to get done for the benefit of the patient and for us. And we're not beholden to the administrators. We have to work with them, but we're not beholden to those people. Strictly every decision, is it good for the patient? Is it good for the hospital? Is it good for the doctors?
Absolutely.
And so if someone has a COVID, they know they have it, and now they have something else going on that they just, and I take it that's entirely possible. Your body is not going to necessarily stop its other functions and whatnot because you have a virus. And you're fighting that virus, and I don't know, you fall down the stairs, you sprain your ankle. What does that person do? Do they have to alert the staff at the hospital or the paramedics, that they're positive?
Yeah. What I'd like to tell my patients is just because you have one thing wrong doesn't mean you can't have two. So That's exactly what you're saying. If you already know you have COVID, it kind of makes it easier for us. It's like, all right, we still have to fix you. And that's what people don't understand is that you still need help. We will fix you. And if we know you have COVID, then you wear a mask, I wear a mask. But I would have done that anyway, but it almost makes things a little easier. The fear of not knowing is really stressful.
Doc, if they have COVID, are they in a separate wing of the hospital?
Yeah, we have separate COVID units in the ER for COVID and COVID suspected patients. We pretty early isolated whole floors for just COVID patients. And in the intensive care unit, we have a separate walled off locked area for COVID patients where everybody who comes in has got to be gowned up, protected, et cetera.
Yeah, so people should be aware of that because that's a safety precaution that's built in and should give you a little bit of solace that if you go there, you're going to be, separated.
You're going to be A-okay.
Yeah.
Yeah.
I'm starting to lose my voice here. Starting to lose my voice for whatever reason.
Take a drink of water, Rob.
Yeah. So what, in a nutshell, and I know this is not necessarily your area of medicine, but in a nutshell, what makes this virus so concerning, so potentially deadly?
So, okay, let me see how fast I can do it. It's a novel virus. And what that means is when it showed up last year, not a single person on the planet had been exposed to it. Means no immunity, no nothing. And we have to figure this out now. Coronavirus, which is the type of it, there's been 7. The first 4 are the common cold. Number 5 was SARS, number 6 was MERS, and this is number 7. We've never successfully made a vaccine for a coronavirus. We will. We got to work on it, but we never have. We don't have good treatments for it. We have crappy testing for it. We don't even know how it works. We're trying to figure out how it behaves. We heard about, it affects the elderly. Now we know it doesn't. It affects people that are already sick. It started there, but now it's affecting people that aren't. Initially, there were no kids. Now we're seeing this syndrome in kids. So we need to respect infectious disease, not just coronavirus. Mother Nature kicks our asses all the time. We need to respect it. And we need
to respect Mother Nature. That's right. Very good advice.
We're Larry and Rob Mandel, the brothers-in-law, here on Go Country 105. Do you have a legal issue you need help with? We want to hear from you.
Find us on Instagram and send us a message. Then tune in on Saturdays at 8 a.m. right here on Go Country 105.
Stay connected with us on Facebook, Instagram, Twitter, YouTube, and of course, brothersonlaw.com.
From all of us on the Brothers on Law show, we want to give a big thank you to these sponsors who we've partnered with to help honor our local heroes and groups for going above and beyond for their community. We'd like to thank Ralph's, Whole Foods, Target, and Chipotle. Thank you for all you do in our community.
Well, thank you, Dr. Mo. And for more information on Dr. Mo, you can follow him on Twitter, right, at Heilbron MD, Heilbron MD. Correct, Doc?
That'll work. Sure.
All right. And I think it is about time we wrap it up and say our goodbyes. And it's been, again, we could talk to you all day.
Yeah.
Dr. Mo, you're a great guy. You are one of the heroes out there. We thank you so much for what you're doing in the community and for joining our show and filling in our listeners like you've done.
Anytime.
Yeah, super educational.
And so, ladies and gentlemen, we're going to say our goodbyes until next Saturday. And if you've missed any part of the show, you'd like to hear our previous shows, you can go listen to us on YouTube or brothersonlaw.com, or you can even tune in to iTunes or Podbean. Right, Larry?
That's right. And if they have a legal question or a show topic, they can call us and leave a message at 1-800-310-7113.
And Larry, they can call that number too if they want to nominate someone in the community like wonderful Dr. Mo or like our chiropractor, Dr. Lopez. And, we're going to acknowledge them on the air for sure.
That's right.
What's that number again, Larry?
Oh, it's 800-310-7113, Rob.
All right.
We got a big thank you to all our listeners out there, and stay safe, please. And we look forward to being here next week on Saturday at 8 a.m. on Go Country 105. And remember,
let the scales of justice tip in your favor.
The opinions expressed in the Brothers on Law show are for informational purposes only and are not a substitute for personal professional legal advice.